Hello everyone, welcome back to this new session of the Diusa Pet Academy. I am Marco Cavazzoni, veterinary doctor, marine biologist, expert of animal nutrition. I'm the scientific director of Diusa SA Group and the managing director of our Italian factory. Today we are going to speak about two very special products in Aleva Care range, which are renal antiox and urinary 360 degrees. Both of them, they care about the urinary tract, but the renal antiox has as specificity the upper urinary tract, which means the kidney. The urinary 360 is more focused on the pathologies of the low urinary tract, the urinary bladder. Speaking about the renal antiox, the word antiox is anticipating also in part the mechanism of action and another indication of use. In fact, the renal antiox is not just for chronic kidney disease, but also for oxalate stones. That's why antiox, it reminds the efficacy of preventing the oxalate stones. Not only, the antiox is also reminding us that we need to apply the maximum anti-inflammatory antioxidant property to our formula for supporting the kidney which is damaged. In fact, the chronic kidney disease is a progressive chronic pathology, which is not possible to stop, just to slow down. It's very important to detect in the early phase. There are 4 stages, because once you are in stage 3 and 4, the animal is already condemned. It is a very frequent pathology, especially nowadays that our pets are getting older and older. In fact, it affects most of the dogs and the cat which reach the elderly age. The normal traditional nutritional approach to the chronic kidney disease is the reduction of the protein content of the formula, plus the prevention of certain conditions like the hypokalemia or the hyperphosphatemia. So we need to add potassium or to reduce the level of phosphorus. At the same time, the addition of potassium can bring our formula to have possibility to alkalinize the urine, which brings us to the nutritional treatment of the second destination of use, which is the prevention of formation of stones, urinary stones. The same formulation of renal antiox, because of the prevention of hypokalemia, is supporting the alkalinization of the urine, thus the prevention of stones that form in an acidic environment. Of course, to prevent the formation of those stones, we need to remove also the main substances that compose those stones, like for example calcium. That's why the calcium in this formula is always a little bit more moderate, more reduced than the average, but always in relationship with phosphorus and always respecting the minimum for the maintenance, because we remember that Aleva Care diets are functional and complete at the same time. Speaking about our antioxidant property, so the ability of our formula to reduce the oxidative stress on a very metabolically active organ like it is kidney, it's very important, and we achieve with the combination of our phytonutrients. We are the first and unique in the world to adapt this concept, but actually it's very known in literature how is important to reduce the oxidative status and also the inflammation on kidney to have an improvement in the management of the pathology. The two phytonutrients that we are using, the two categories, are the anti-age mix that we are using also in our Aleva Holistic. It is known to be able to prevent the cellular aging, so to preserve the ability of the kidney to function properly. We are combining the efficacy of this anti-age mix with the most powerful antioxidant present in nature, astaxanthin. Astaxanthin is a xanthophyll pigment which is used by the plants to protect themselves from the UVB that would damage their DNA during photosynthesis. So it's very active in preventing the decaying and the modification of the biological tissues. That's why it's 10 times more effective than vitamin E, 100 times more effective than vitamin C inside the body organs. Where do we source this astaxanthin? We have the primary source, which is the microalgae Haematococcus pluvialis, the main producer of astaxanthin in nature, and of course we are supplementing it with the krill oil. Krill, it's crustaceans living free in the ocean, where it constitutes the largest biomass of our oceans, and in turn feeds on the microalgae which synthesize this astaxanthin and which also synthesize the omega-3. In fact, the krill oil is a pure concentrate of astaxanthin and very absorbable omega-3, so that we can use to support the level of omega-3 brought by the fish oil. Taking a look then to the formulation, we remember that it's a formulation where we need to control the level of proteins, because the level of proteins is what can damage mostly the kidney if the kidney is already damaged, and we never go below the maintenance level, which is 18% for adult dog, because we want our product to be complete. Not only we are reducing the protein, but we are using the best quality. In this case, eggs. Eggs have a very complete amino acidic panel. They contain all the essential amino acids. Thus, they are the best protein source for a product where the protein should be very, very limited. The source of carbohydrates are grain-free, purified source of starch like potato and peas. So with removing the part of the proteins, because again we need to put a moderate level, but just the best. Then you can notice in the formulation the providing the source of fats, in this case chicken fat and fish oil, the first for palatability and for essential fatty acid, and the second for the omega-3, which are so important for us to support the krill oil, also down into the label, in reducing the inflammation on the kidney. You will notice also a big amount of soluble fiber in this product, because they are able to support the intestinal system while processing metabolites of the proteins that can re-enter in the bloodstream and damage even more the kidney. Plus the source of minerals which we are using to influence the pH of the urine, but at the same time to compensate the losses due to the inability of kidney to keep some mineral inside the body. We see here the potassium citrate and the potassium carbonate, able at the same time to prevent the hypokalemia, so important for the chronic kidney disease, but at the same time also to alkalinize the urine, so important to prevent the stones of oxalate. This product is also suitable for the stones of urates and cysteine, because it is reduced in protein and reduced in those proteins that can create the matrix for the calculi of cysteine to congregate. Speaking about the second product, the urinary 360, the name 360 is already telling us that we use this product to care about the low urinary tract at all around. We are addressing, in fact, not just the classical system to dissolve the urinary stones. In this case, struvite stones is the main indication of use of this product. But we are also using systems to prevent other very important urological syndromes like the feline urologic syndrome and feline low urinary tract disease. They recognize an important contribution of stressful factors that develop idiopathic cystitis, especially in cat. We need to address those stressful factors in order to help the remission of the pathology. How to do this? We decide to create a complex of phytonutrients and other functional elements that are able to prevent the three main kind of stress we recognized. We have the stress which is mechanical due to the stones, in this case struvite or calcium phosphate stones, that can damage the urinary bladder. We want to restore the urinary bladder inner layer with a special supplementation of glycosaminoglycans, namely glucosamine and chondroitin in very high amount, which are known to be able to constitute the inner layer of the bladder. Then the second kind of stress we want to address is the oxidative stress. As we saw before, the oxidative stress is able to worsen and make much more quick the progression of the pathology. We want to prevent this, also in this case, by the use of a very special Ayurvedic herb mix, which is proven, clinically speaking, to prevent the oxidation and to block the formation of oxygen-reactive species. The third element of stress that we want to prevent and solve is the emotional stress. Everybody knows that, especially for cat, a stress like a long journey, a new house, or a new housemate can contribute in the development of the idiopathic cystitis. Well, we are going to prevent this stress and to solve with a very special extract of Melissa officinalis, lemon balm extract. Taking a look to the formulation, we can then highlight what are the points important to the different destination of use. As well as before, we need to moderate the amount of protein because the proteins can produce substances which contribute to the formation of the stones. We have a moderate level, but the best quality. Eggs again. Again, like the previous product, the source of starch are grain-free, purified from the protein source of starch like potato and peas, and again, like the previous product, the source of fats are fish oil, herring, for its richness in omega-3 and the ability of reducing the inflammation, and the chicken fat for giving palatability. A lot of source of soluble fiber, but very important to notice is the presence of cranberry, another phytonutrient which is able to prevent the adhesion of gram-negative bacteria to the walls of the lower urinary tract, and in this way it prevents the pathogenicity of those bacteria. But also you will notice in the composition the Ayurvedic herb mix able to fight the oxidative stress. You will notice the glucosamine and chondroitin in very high amount, 0.2 and 0.1%. And then finally, you will see what are the main ingredients that make the shift of the urinary pH to acidic in order to dissolve the urinary stones like struvite. It is calcium sulfate and the L-methionine. Taking a look to the analytical components, we see that the perfect balance of the minerals is able to influence the pH of the urine, and the amount of omega-3 and omega-6 glucosamine and chondroitin are able to support the well-being of the urinary tract. So to sum up, two products that can care about every kind of issues related to the urinary system, but at the same time they can contribute to the well-being of the animal and to the maintenance on the animal on the long run, because those products can be used for all life long. So it's all for now. Thank you very much for your patience and attention. If you like our contents on the EUSA and on AlevaCare, stay tuned on us because more products are in testing and they will come soon. Ciao!